I took a course about plagues and literature taught by an RN who went back and did a PhD in comparative lit. And in that class, we studied AIDS literature. And I really became deeply interested in the world of HIV. It was not only a medical problem, it was a social problem, it was a political problem. I knew that I wanted to train in HIV research, and infectious disease is a field of medicine where I could really use that interest to help take care of people.
The infectious disease fellows here at Mount Sinai receive a broad breadth of training, including our inpatient HIV medicine service, our organ transplant and bone marrow transplant oncology ID services, and in emerging pathogens.
We are a large academic medical center in New York City, and also a large transplant center that performs liver, kidney, small bowel, heart, and bone marrow transplants. Our infectious disease fellows have the unique opportunity and privilege to help take care of these patients.
So first year of the fellowship is primarily based on clinical ID.
Fellows rotate on our solid organ transplant and bone marrow transplant oncology services during their first year, allowing them to really focus on the immunocompromised host. We have a large group of dedicated transplant ID faculty who provide our fellows with the training on how to prevent, treat, and manage infections in transplant recipients and immunocompromised patients.
My first month of my first year fellowship, I was on the solid organ transplant service, and it really did ignite this passion that I didn't realize I had. We were exposed to these amazing pathologies that I wasn't used to seeing in my residency.
Our transplant program is also involved in HIV to HIV transplantation, and that really allows fellows the unique opportunity to take care of solid organ transplant recipients with HIV.
In your second year, you then hone in on what research topic that you want to do, so it depends on exactly what interest you have.
Infectious diseases fellows who train at Mount Sinai will be prepared for whatever subspecialty of infectious diseases they want to pursue. We offer a wide range of training in infection prevention, hospital epidemiology, clinical and laboratory research, public health, transplant ID, and even the pharmaceutical industry.
The importance and value of a collaborative learning environment became so clear during the COVID-19 pandemic. Our division worked with leadership and teams throughout the hospital to direct patient care, as well as diagnostics, practice guidelines, clinical trials, and expanded therapeutics.
We banded together as a department. That was an amazing feeling.
The collaborative spirit of our colleagues within the division here is evident. The access to respected experts and world-class facilities here at Sinai makes this an ideal environment to train for a career in infectious disease. We prepare our fellows not only to follow the guidelines, but train them to have an active role in creating them.
Mount Sinai combines the clinical rigor of a great clinical infectious disease program with the resources and guidance of an outstanding research program. And it gives you the autonomy to figure out how those two fit together in the career that you want to have. They really want you to be the best version of yourself that you can be. When you walk in the door, they see your potential, and then their goal is to get you to get to that potential in the best way they can.